Medical professionals have found that older people are more likely to have a serious or life-threatening case of COVID-19. Dr. Melissa Agard, an internal medicine physician with ClinCloud, has joined me to talk about why older adults are particularly at risk. Dr. Agard, welcome.
Thank you.
Let's start by talking about how the health needs of older adults may be different from the general adult population.
Well, in the elderly population, probably about 50% or more have at least 3 medical conditions by the time they're in their 60s. They may be doing well, but those medical conditions may lower their immune system or cause previous damage to areas like the lung, which places them at a higher risk for severe COVID-19 symptoms. This, of course, is in comparison to a healthy younger adult in the general population.
How do changes in our immune systems translate into higher risk for COVID-19?
Well, changes in our immune system can influence how severe the infection will be. Our immune system is basically our defense mechanism against any virus, any bacteria that we come in contact with. When we do have a chronic medical issue or we're taking certain medications, this can lower our immune system and our defense against a virus, which will then trigger a more severe infection, which then leads to more severe complications, of course.
Are there specific health conditions that seem to make elders especially vulnerable?
Well, the main conditions that we've identified are lung disease, heart disease, kidney disease, and diabetes. We've seen that in most cases when patients do have these particular illnesses, it makes them just at a higher risk of, 1, contracting the infection, and 2, having a more severe outcome.
Do you suggest elders create a family medical plan during this crisis?
I do believe that elders should create a family medical plan during this crisis. In the event that they become ill, a caregiver becomes ill, or in our current situation, they do have to stay at home for an extended period of time. I think, having things in place like extra medication at home, having a list readily available with their medical conditions, medications, allergies, and so forth, if that information needs to be relayed, having it ready is important.
Let's go over some of the common signs of COVID-19 in the elder population.
Well, some of the common signs are actually the same signs for the general population. So those signs are basically encompass fevers, cough, shortness of breath, or other flu-like symptoms. If you start to experience those, then those can be symptoms that are related to the COVID-19. Now, I also want to point out more severe symptoms would be heaviness in the chest along with difficulty breathing. Maybe your lips are starting to turn blue from lack of oxygen, or you start to become altered. These are more severe symptoms and definitely would require medical care.
Now, if someone feels they are exhibiting symptoms of COVID-19, who should they contact?
Well, the first person that I definitely think they should contact is their medical professional, whether that be their primary care doctor or a different physician, just to have direction and what the next step should be, because they will assess their symptoms and let them know. Another option, of course, is definitely calling the COVID-19 call center and, getting direction from them on what the next step would be.
Do you have any final thoughts on COVID-19?
Well, I do think that this is a very uncertain time for the elderly, and it can trigger much stress and anxiety. We're all being asked to stay at home in order to protect ourselves, and I think it's very important that we continue to take care of ourselves as best as we can. With that said, I know we're being asked to have a lot of physical distancing, but I want to make sure that people are not emotionally isolated either. So I just want to recommend to the elderly, make sure you keep in touch with your loved ones and your friends and just stay safe in this time.
Dr. Agard, thank you for stopping by to explain why seniors are especially vulnerable to COVID-19.
Thank you.
And stay tuned for more informational segments right here.